Hi, good afternoon. Welcome everyone to the Board of County Commissioners work session on Tuesday, June 9th. I'm Kelly McNicholas Curry, Vice Chair, and in the room with me is Patty Clapper, Commissioner, and John Peacock, County Manager, and our IT support, Jordan Bachelor. And I'm going to turn it over to our Chair, Steve Child from home, to run our meeting today.
Okay, thank you, Kelly. And speaking from home, we have myself, George Newman, and Greg Postman are all at our individual homes. And then I see joining us on the screen are Chris Padilla from the airport and Nan Sundin from Human Services and Rich Engelhardt from administration. So our first item today is second quarter budget supplemental requests. And I'm not seeing Connie on the screen. Are you going to do that, John?
Yeah, thanks.
Yeah, thanks, Steve.
Connie is not able.
Connie is not able to be here.
Oh.
Oh.
You have to turn your computer audio off.
Okay, sorry, I had too many devices going at one time there. Can everyone hear me okay now? So in front of you today are our second quarter budget supplementals. We on a quarterly basis bring budget supplementals for expenditures that were not anticipated when we developed the 2020 budget. Of course, this has been an unusual year too, where we've had a number of emergency appropriations in front of you. The appropriations that we'll talk about today total just over $3.5 million. They are offset by an increase in revenues of $2.8 million, just over $2.8 million, for a net increase of just under $740,000. We have a number, we've got 6 requests to review with you today. I'm going to take the first couple that Connie is not able to cover today. The first is an incident management team grant from the Public Safety Council. Since 2015, the Public Safety Council has provided an annual grant to Pickens County Incident Management Team to be used for training, education, and materials related to incident management. This could be used to support exercises and those sorts of things. It is a $6,000 grant, and we are proposing an appropriation to cover that with no use of fund balance. Any questions on that? The next item, actually, I'm going to turn this one over to Rich. It's EHOP. Rich, are you on?
Sure. Thank you, John. Yeah, this is, as you know, our county offers 2 different programs for our employees. There's the EHOP program, which is a employee home ownership program. and it is a program that allows for down payment. So it's a down payment assistance, and our other is a deed restricted program. I guess this is good news in the fact that we're coming back asking for additional dollars because we have had some employees take advantage of this. We had pretty much expended that account. We do have revenues coming in. Again, it's a grant type program, a loan program. So we do have revenues coming in, but not enough to cover additional requests. So we had an employee and we had two others in the pipeline that were looking at this program. And we had run out of the money, so we needed to come to the board for an appropriation. This ends up being a general fund appropriation rather than a transfer of our housing fee money. It does not qualify for that program, so this is an expense that would certainly come out of the general fund, but it supports the board's desire to continue to provide employee housing to our employees. So if there's any questions, I'd be happy to answer those. This is run through a third party, by the way, that administers the program for us.
George?
Oh, thank you. Rich, can you, again, just remind me, at least, on the loans that we've closed, $100,000, what is the interest rate, and do we set it up as a revolving loan?
Yeah, George, the interest rate is set at the time. It's a low interest rate through our third party, and it's an adjustable rate depending on what's happening in the market. I don't have that number for you right now, but it's, I believe right now we had set it up to fall, and I want to say 2 points below the market rate, but I can get that information for you.
Yeah, 2 points below the market rate is probably about.
It's not zero anymore, isn't it? Yeah, yeah. These are very low interest loans for sure. So, but I can get you that interest rate that has been used here lately.
And so because it's that rate is so low, it doesn't really, even though this is a revolving loan program, it doesn't really generate enough to increase that assistance fee by very much.
Not very much. No, it doesn't. We do get, again, the money that's put into it. There's a portion that goes to our third party, and the rest does come back to us. But it doesn't generate a lot back. But it is a repayment program.
Over what period of time?
It's based on their loan. It could be a 30-year. We do have an option within this one that after 15 years, if they are still in the house, that we had it set up to where we would waive that interest repayment portion for those employees. We haven't ever had one of those happen yet, but that was part of the program the way that it was initially set up.
And then my last question is, you were going to keep us updated in terms of where the loans, not per se where the people were using the loans, but where they were purchasing within the valley.
I can do that. I know I did on the deed restricted. I don't know that we have, and we may have actually a while back, George, had shown you on this a down payment assistance as well, but I'd be happy to do that. I don't have that for you right now, but would certainly show where those residents, I guess, are located.
Yeah,
they're accessing this. And again, this isn't restricted like our deed restricted program to a certain geographical area. It is a down payment assistance. It's, it goes on top of their mortgage payment as a repayment, just a low interest repayment back.
All right, thank you.
You bet.
Any other?
I have a
question.
Let's see. Let's go to Kelly and then Patty.
thanks. Steve.
Thanks. Yeah, I just have just for a little more detail on that. Is that how much revenue is coming in on an annual basis for this program, and are these being repaid in one lump sum, or are they being repaid over time? Monthly.
Yeah, they're set up on a monthly payment system that goes back to the third party. They manage it for us, and again, I can those numbers for you. I thought that Connie was going to be presenting today, so I'm sorry, I'm a little bit cut off here, but I would be happy to get you a lot more details on this whenever we set this up for the actual board meeting.
Mm-hmm. Okay. And then finally, I guess another question is given, I'll look to John, what the staff recommendation is on this, if there is one,
As far as funding this right now?
from the general fund, yeah.
Yeah, this is a long-term investment in employee retention, and the down payment assistance program tends to be high value from that perspective. We think that we won't be able to continue necessarily doing this until our finances do turn around. I will say that our April sales tax is looking to come in much, much better than we projected. And hopefully that will continue in May, and our projections, as they often are, will end up being conservative on the revenue side. But in terms of the potential savings in employee turnover, we think this is a good investment.
And then I guess the final question that would be probably data from Connie is what our budget pie has been in the past. Because this seems, this is a reactionary request a little bit, because we've had successful participants early in the year. And so I'm just curious as to, in the past, what maximum annual amount we've put towards this program. Thanks.
And I would just note too, it will take quite a bit of time before there's enough loans out there to generate cash flow. When you have 20 and 30-year mortgages, it will be over $1 million that needs to be out to generate about $7,000 to $8,000 a month, depending on the interest rate.
To come back into the county
to come
general
back
fund.
into the fund. And so what you're seeing is we're building that capacity up over time. There probably will be a tipping point, and that would be interesting for us to look at a little bit more based on those maximum years and what the average is when this does become self-sustaining more as a revolving loan fund. But we're not far enough into it at this point to have built up enough equity in the loans really for that. Sorry, Patty, I stepped in front of you.
No, that's okay. Just want to make sure Steve's.
Okay, Patty?
Yeah, I was going to pretty much ask the questions Kelly was going was how much money are we generating coming back into the revolving fund? I sit on the revolving loan fund board for Northwest Colorado Council of Governments. And so we look at those monies, but they're smaller amounts, shorter return. So they come back and they go back into the fund. And then what's great about that program is those funds that come back on part of the revolving fund pot of money can be used with a lot less. They have a broader range of use than the money coming in. So it's pretty interesting. Yeah, so we do need to keep track of that, and I think as part of our budget, look at that would be a great conversation when we do budget. Look at the little bit of money that might be trickling, what the management fees are, and what we can look at long term as far as accruing that money back in to make it a sustainable fund. When I first read about this, I was like, oh God, more money coming out of the general fund. But if employees are able to utilize it now at this time, I think it's critical. I think we need to support it. And let's just see how it pans out. I mean, we might have a limit we have to set for this year, and that's before we overextend the fund. Let's kind of keep on top of it when we need it, if we need to come back for more money before the 2021 budget. But thanks, Rich, for winging it, being the wingman there.
Oh, you're welcome. And again, this would be the 2020 request, the final request for this year.
Okay, thank you.
So. Thank you all.
Hey, Kelly again, then
Yeah.
George?
Thanks. I guess I would just, I guess the concern I have is it favors employees who move quickly early in the year. So if you have a great opportunity to buy a house in October, you may not get to take advantage of this. There's an equity question there for me about that. So maybe as we think about this, perhaps staggering the availability of that loan money might help some people.
Yeah, Kelly, it's a good point. Equity is a big deal with our organization for sure. We've been fortunate so far in both programs that we haven't had to kind of pick and choose. We've had the money available to be able to get into it. This is the first time I believe we've had to come to you to add money to this pot for the down payment, and we're starting to see a little bit more activity there. So that's a good point. We may have to think about that.
Well, and then with regards to the amount being requested, is this matching a need right now, or is this matching a need plus?
Well, it does leave the additional ability for, it looks like, one more additional loan. It's a need plus one, possibly.
Okay. And so at the end of the year, if it's not spent, it would come back into the general fund. Yeah.
Yeah, for reappropriation, the next a decision making over.
Okay. Thank you.
Okay, George?
Yeah, thank you. Rich, again, just as a reminder, this goes for the help with the initial deposit, down payment. And is there a percentage or limit that someone can utilize?
Yeah, the maximum amount is $50,000. We have had loans that have been less than that, and it's usually part of the qualifying process through their mortgage company of their availability to afford what they can afford. So this supplements that, being able to help with that down payment, and then it works into their overall monthly income or monthly ability to pay. So it does vary, George.
And so it varies with the percentage as well?
And on their percent of qualifying through the mortgage company. Now on their ratio, you've got the expense to revenue ratio that the mortgage companies run that kind of sets your ability to make payments. And so that all factors into it. And so that's why we have a third party involved with the mortgage companies helping with qualifying these people. We have had some that just simply didn't qualify for the program.
Yeah, and I think all these supplemental budget requests are coming back to us at a regular meeting tomorrow, and so that's the case. We have some of those questions answered
Sure.
when it comes before us tomorrow.
Okay, Greg, do you have any questions? I think my questions have already been asked by some other people, so I look forward to the, more information tomorrow in our regular meeting. So let's move on to the next item.
Okay, thanks, Steve. The next item is a supplemental request related to supplies and services at the airport related to COVID. Do we have Chris on the?
Yeah, he's there.
So the airport terminal, when it's operating at full capacity, which is definitely not at the moment, is one of the busiest, if not the busiest, building on the western slope of Colorado in terms of number of people coming through. So it represents a significant challenge in terms of keeping sterilized and clean and those sorts of things. And that's really where we're at here. Chris, I am going to turn it over to you with that introduction and talk a little bit about this budget request. And Chris, we can see you, but we can't hear you. Is he muted?
Chris, did you happen to call in as your audio source? I'm sure you can answer that question. Is anyone familiar with?
Can you give us a thumbs up if your last number is 1819? Okay.
Could you give a thumbs up?
Yeah.
Well played.
All right, thank you. Sorry about that.
Okay.
I can't ever get my computer mic to work. So, yeah, my name's Chris Padilla. I'm with the airport and airport controller. So, due to the pandemic that happened, we had a huge increase in supplies needs and decontamination needs, and to kind of meet this and to keep the airport operational as an essential service, we went out and first got a custodial service to come in and do complete decontamination services. And we're asking for $250,000 in that category to carry us over till the decontamination foggers come in, which cost us $158,214. And then from the very beginning of the start to the current amount, plus some pending invoices, we're asking for another $89,977 in the fog chemical that is about a 4-month supply depending on the intensity of use, and other cleaning supplies, PP&E, signage, the plexiglass that you've seen in the video for the restrooms, and any of the upgrades in the terminal seating area. We're asking for a total of $498,191 to be able to cover those costs. Any questions?
I have a question.
Patty?
Yeah, Chris, thank you. So $715,000 is a lot of money. And we're cleaning, this is just for the terminal, and is it for airport vehicles also when we have to decontaminate between users or at a certain period of time?
No, that's actually being done by staff.
Okay.
And so the $715,000 is actually the adjusted amount. The original amount was $465,000. We're asking for $250,000 for the decontamination services, backdating from March
Well, is
to
any,
the current date plus.
okay, but are any of these monies like the foggers or the supplies, any of that going to, I think, anything other than the terminal? Like the employees
Yes.
cleaning the individual cars. So that's accumulative, because it's just, the whole amount is a lot. Are the airlines, I know the airlines are strapped for dollars as everybody, but are they contributing at all to this cost? Are they using any of this for decontaminating the airplanes?
No, these are all strictly for the airport and the airfield, the AOC, and any kind of other related airfield and terminal needs, not for the airlines. The airlines have supplied their own plexiglass, I guess shields, you'd call them, at the ticket counters. The same thing with the car rental companies and any of the other tenants. The airlines, they decontaminate their own aircraft. We wouldn't be able to split that out between the airlines anyways,
Okay.
and be able to.
All right, thanks, Chris.
But
Okay, Greg?
Thank you. Thanks, Chris. I think this is necessary. My question is the fogging equipment and the chemical being used the state of the art, and how long can we expect this to be the state of the art of what's happening? We're in such a changing landscape where we've seen decontamination go from ozone devices to hydrogen peroxide mist devices to who knows what's next. But I'd love to know what this is, and is it proven, and how long will this technology be in use for the purpose? Because I can imagine it evolving.
yeah, I mean, especially now, I would imagine that a lot more money is being poured into R&D, especially for these kind of devices. From my understanding, these are the latest and greatest. And I think from what I saw in the research part, a lot of it had to do with the chemical and the way that it was atomized. One of the cool things about this is that it's not just a fogger, it's not just something that creates a mist, but also has some specific hoses. So you have kind of a hose gun where you need to get into some nooks and crannies or desterilize a certain piece of equipment or even a phone. There's actually a handheld piece to it that you can actually decontaminate that. So with these were also designed to go ahead and basically, there's a certain square footage cube that it's able to cover, and with each one of those machines, that's why we have 6 units. It would basically just fill up the entire area, and anything that's non-airtight it would get into. For what we needed, these were the latest and greatest that I know of. I can confirm that, and and send that back out.
Right. I'd love just to find out if you've looked into the UV light systems that I know are out there. I'm sure you're looking at all that stuff, and a lot of stuff is coming along, but just want to be confident that what we're buying is going to be something we're still using in a year or 2 or 3.
Yeah, no, I agree. So I asked about the UV lights personally, just because, I'm watching the budget. So one of the problems with the UV light is that you'd have to get up high. You have to be able to make sure that the UV light is directly hitting that area, that surface, and that there's not any kind of shade that's happening with it. It has to directly hit that surface that you're looking at. So anything inside any vents or under the seats or anything like that it would be really difficult to get into.
Got it. Okay, thank you.
Mm-hmm. No problem.
Okay, Kelly?
Thanks. Hi, Chris. Hope you're doing well.
Hey, Kelly.
I have a
Nice to
couple
meet you.
of questions. So, is this type of system something that can be used in the event of other infectious disease traveling through the airport?
Yes, it's so this is equipment that's used across the spectrum from locker rooms, football, or sports locker rooms, all the way to large area decontamination industrial sites. So it does take different types of chemicals. Again, I can 100% confirm that here in a little bit. But from the pamphlet I saw and the research that I looked at, it was a wide range of different chemicals that you could use for it.
Okay. That's helpful for a longer term investment. And then will the FBO use any of this, and will they contribute to the cost at all, if so?
These are not being used by the FBO. The FBO has been supplying. At the beginning, and they've been pretty on top of it. At the beginning, we offered them some initial supplies to make sure that we were keeping the community safe. They were already on top of it. They had all the hand sanitizer they needed already shipped in. They had their own gloves, the face masks. So they were on top of it right away. If there's any kind of request, it probably would be one-off. And then what would happen is that the way that the FBO and the GA would pay for this is that it would be rolled up into our rates and fees models.
Okay. And then finally, with regards to the specific budget request, I know on the materials and supplies, this is a 4-month supply, so there's a limited duration. And, just give us a heads up if you think you're going to need to come back for the next 4 months or 2 months of the year. And then finally, for the custodial services, does that get us through the end of 2020?
No, so that's the good news, and that's kind of the balance between the decontamination foggers and this custodial. The 250 is the projected amount to get us to the time when we have the foggers, and the payback time for the foggers to the custodial is about 1.5 to 2 months, depending on the chemical usage.
I see. Okay, so custodial decontamination is expensive.
It is very,
$25,000 a month. Okay. Thanks for helping me understand that.
Yep, no problem.
Okay, George?
Chris, do you know through the Department of Transportation, is there any funding that will be available for airports to address issues like this?
Not through CDOT specifically. Any of the equipment right here, we are looking at to see if any of it's reimbursable. I know that I've been talking to the Benton County Procurement, and there was some questions based on past experiences. But we are looking there's a possibility that we could get some emergency response type of reimbursement, but again, we've been kind of told that may not that may not happen, and it might happen. We just have to go ahead and submit it to get the response back.
And again, this was not through CDOT per se, but just through the Federal Department of Transportation as well.
Correct.
And Chris, we did receive CARES Act distribution through the FAA to make up both for lost revenues and costs associated with COVID, I believe. Do you have those numbers by any chance?
Yeah, so we received, so we'll be bringing that forth tomorrow on that resolution. So we received $3.4 million of CARES Act. The FAA had asked us to apply them to our O&M expenses first before any kind of revenue allocation coverage. So we did do that. And this is, this would be considered part of that O&M cost that we would apply this to also. Was there any other specifics that you're looking kind of towards that, John, or I can talk more to it?
No, I just wanted to note that since that would be talked about tomorrow, and I think that's in line with what George was asking.
Oh.
Yeah, so John, we'll see perhaps a revenue source to help offset some of this request.
Well, George, unfortunately, I think it will help with the pain, but I don't think with the additional costs and reduced revenues, it's going to cover everything. But it does keep our fund balance healthy in the airport fund.
All right, thank you.
Mm-hmm.
So this item I see as an essential thing for having the airport be safe, so our visitors coming here will feel safer flying into the airport and coming to Aspen. It's really an essential part of our whole strategy for having a safe community that people can come to. Any further questions? Okay, let's go on to the next one.
George has something.
I think the next. Oh, George?
Yeah, one quick thing, and I could ask this tomorrow too, but just following up on your comments, Steve, I know some airports are now doing temperature checks for passengers coming in. Are we looking at doing that?
Yeah, we do have thermometers already ordered on delivery. We actually, based on research that staff had done, they have a handheld that can be moved around versus the big cameras. One of the concerns that we have, though, is there needs to be broader symptom tracking, because really only about 30% of those that are infected with COVID are showing temperature as a symptom versus many of the other symptoms that are on our symptom tracker. And the logistics of that are difficult to work out. So we are continuing to work on what symptom screening could look like at the airport, but we do have the capability to do temperature screening, but to be effective, it probably needs to be a little broader than that.
Yeah, I understand that, but at least it could raise a red flag to be able to then follow up with any people coming in that are showing a temperature that's not quite normal.
Mm-hmm. Absolutely. So yeah, the equipment is ordered. The process we're figuring out.
Great.
Okay. So I will take this one. This was one Connie was going to do. This is Public Health Emergency Preparedness Grant funding for COVID-19 response. This was distributed by the Colorado Department of Public Health and Environment to be allocated at the county's discretion to high priority needs. The total amount of the grant was $30,792. This is not one of the funding sources that we were talking about during our emergency appropriations last week. And it was I'll be frank, a slightly disappointing amount to be distributed in those first rounds. But we would apply these to the staff that we contracted on. For example, our epidemiology staff, Charlie, who you've seen is a good example of where we would be applying these funds. These, frankly, are already spent. They're pretty. We can justify a number of expenditures that could be allocated against this grant source. So I will leave it there for questions.
Kelly?
Do you know the total bucket that this was allocated from?
I can probably find it in a few minutes, but I
Sure.
don't know it off the top of my head.
I'm just curious as to how this fits into the larger distribution of state and federal funds, but thanks.
Oops, I got onto the wrong page.
Okay, don't see any other questions, John?
Okay, we'll move on. TANF funding, and I think we have either Nan or Sam on for
Nan
this
was
one.
on.
Thought it was- Oh, there you are. Nan, you want to take this one?
Yeah, yep. This is easy for me. So, yeah, this is a supplemental that gives us permission, I guess, to spend and receive the funding that we didn't budget from TANF to provide emergency funding to TANF eligible families during COVID. So as you all know, the allocation is only $90,476 for TANF, which ends July 1st, right? We get a new allocation next state fiscal year. And we have about 100,000 in TANF reserves, and that's the most that we can keep in our TANF reserves. We have spent 378,000. We've allocated that much to TANF families for COVID relief. So our intention was to buy 300,000 in TANF dollars, where we pay 13 cents on the dollar, to replenish our funds so that as best as we can, we should be able to start state fiscal year 21 with a full reserve of 100,000. Now my team is meeting as we speak right now. The state also, JBC allocated an extra bunch of money for COVID relief for state fiscal year 20. And so we will also be looking at, if there's any opportunity for us to get any more dollars just to fill that TANF reserve up to 100,000. That's the max that we can fill it up to. So this gives us permission first to just reallocate the budget so that it fits with the money we've spent and the money we've brought in. Any questions?
Okay, I see Kelly. Kelly with a question?
Yeah, with regards to the maintenance of effort, does this money come out of general fund to pay for or out of the TANF bucket?
That's a really good question. If Connie didn't identify it, it either comes from the general fund or the human services fund balance, which is where I would think it would come from.
Yeah, that's where it looks like it comes
services. It's human services fund balance.
Okay.
See? I almost know it all.
And then, so is that fund balance separate from where the TANF comes from, or is the 300,000?
Yeah, so let me see if I can explain. The TANF is federal dollars that comes through the state through an allocation to us. right? Pitt County, every year, we make a budget for human services, and by law, that budget, if we are underspent, those monies have to go into a human services fund balance. They cannot go back to the general fund. So, so the fund balance is there for us if we overspend in areas, if we're not closed out in certain, sorry, my phone is ringing. If we're not closed out at the end of the state fiscal year. And so we have a fund balance of as I believe, of about 400,000 in human services. That's going to be really helpful if we don't get closed out in childcare. We're way overspent in admin, right? Admin is economic services and my time. Anyway, TANF allows us to kind of shore up in that program area, so we have the money available if we need it in other areas.
Thank you.
Okay, Nan, I'm not seeing any other questions. You could move on to the next item.
Okay, Nan, we've got the COVID economic relief. Do you want to do this one?
Sure, I'm happy. I read this, so I'm just I forgot about it. So this is a budget supplement. I didn't forget about the money. I forgot what it was about. We love the money.
Fun one.
It's been, such a gift to be able to help the community with these dollars. But just a reminder that when COVID hit, we were the beneficiaries of funding from Town of Snowmass Village, City of Aspen, the Aspen Community Foundation, and some private donors. Bringing in over $2.5 million. So, and we quickly made applications available to the public. We posted it widely. As you all know, we have supported thousands of Pitt County residents with rent, food, utility, and cash relief, and we continue to support them with a June issuance. That is fairly rigorous and requires a lot of documentation to present a needs assessment, a means test, really. And but this supplemental allows us to appropriate the funds that we received that we didn't anticipate in the budget and to spend them. John, you want to add anything to that?
Yeah, I just would like to add a couple of things. One, a shout out for the partnership that this represents, Upper Valley, both from our public sector partners, but especially from the private sector who has stepped up. And this is a really unusual circumstance. Nan, a shout out to you and your team. I would note when we started this cash assistance, this emergency cash assistance program, our biggest year was $50,000. $50,000 in a year was our biggest year following the 2008-9 recession. We're over $2.4 million already a few months into this, and that took a tremendous effort from our community, and it took a tremendous effort from our staff. And just a shout out to other county departments that stepped up, especially the library, to assist human services during this time. So
Thanks, Nan.
If I could just add, the library was tremendous. The finance office has been and continues to be tremendously helpful, and the Aspen Skiing Company completely stepped up with our first round and provided 30 volunteers to help us call every one of the people who applied, and we could not have done it without those ski company volunteers. The applications are coming in much slower now. People are beginning to work. We expect that actually when the stimulus unemployment benefit is cut, we're probably going to see a resurgence of need. Just a heads up that people are still struggling out there, and part-time work is, you know, which could exist for the entire summer, is not going to be sustainable for a large group of the employees who work in the service industry.
Okay, Patty, did you have your hand up?
Yeah, Steve, this is just on a side note. After reading today's newspaper, Nana, I want to thank you for managing for the issue out at the Intercept, or the Park and Ride, Brush Creek Park and Ride. That has been huge, with minimal, if any, real problems, and with lots of benefits. And I think the people who are utilizing it, the neighbors who are in that vicinity, and for the rest of the county, I think that's been huge. And I want to thank you. I know you have such an effort and commitment to the homeless in our community anyway, that this opportunity to provide them with some shelter during this time. And I hope everyone stayed warm and dry last night, and hopefully they'll stay warm and dry tonight. So thank you, Nan. I wanted to give you a big thanks for that.
Thanks, Patty. That's a group effort.
Okay.
So.
Greg?
I'd love to just follow up with Patty on that. You know, as a Brush Creek resident, I have to say, I don't think, certainly and I have not heard any comments at all about how things are being done out there. So I think that's a good thing. No news is good news. And it seems to be going smoothly, and it was good to see the article. So yeah, my compliments as well. I think that as some of the closest neighbors out here at Brush Creek Village, I can say from my experience it's gone very well. So thank you. I did want to ask also regarding the supplemental requests. I'm going to ask you to look into your crystal ball. We're going to get through the summer. There'll probably be reduced employment over the summer. And then, as you said, if we see an uptick in COVID cases, or if as we go into fall and the fall off season, we can anticipate that the demand for economic assistance and food assistance is probably going to increase. And I just want to know, you know, how far ahead are you looking when we're trying to forecast what's coming? How far out are we thinking here?
Thanks for that question. I have two sides of that answer, and I'm excited that you asked. I would like to bring Jessica Valland or one of her representatives in on June 30th, if there's time, to present an economic and work forecast. They've done this in other communities, and they can show where Pickens stands and what we are probably looking at in the next 6 months. I observed this presentation at a Northwest Directors meeting. I think it would take about half an hour. So if there's time, I'd love to bring that in. You know, what they're talking about is really significant impacts to the resort economies that don't have diversity of industry, and that's us, right?
Right.
So they're looking at people, they're kind of looking at 6 months to a year of people not getting back to work full time, people getting laid off as industries, the service industry is working with fewer people, fewer guests. And they haven't put any numbers to it, but I think we should challenge them on that, because that certainly impacts the COVID relief. We are working with Aspen Family Connections, Valley Settlement, Catholic Charities, Aspen Community Foundation, and we have a meeting coming up next week where we want to try to forecast that and see how we all work together to continue to provide the relief that's going to be needed in the next 6 months.
Thank you, Nan. I would certainly support having a presentation like that on the 30th, if that's the opportunity. Thanks.
That's when Jessica was available, so I haven't looked at the calendar, but I'll see if I can get it on.
Okay, I see no further questions. Man, thank you so much for everything you have been doing. I know you've been burning the candle at all four ends probably for the last several months. a lot of these things. And so we'll be looking at all of these supplemental requests tomorrow at our regular meeting. And I noticed, I didn't see it in our packet for tomorrow's packet. And I don't believe it was in there. We'll need to carry these sheets forward to the packet for tomorrow. So, John, we could move on to your COVID-19 report now.
Yeah, and so obviously we've run over a little bit. I will try and do this quickly.
You can leave out that one part, John.
That's the first thing. So give me just a sec here. Okay, is that showing up? So just want to follow up with the board a little bit, because I think we're seeing now our box it in strategy being put to work here. As you're aware, either from the paper or email updates, over the weekend we had a small cluster of cases identified, four positive individuals that were spread amongst multiple counties, which I know is a scenario everyone was concerned about when we were talking about contact tracing. One of those individuals, in fact, the first one to be identified, which you call the index case, is a Picking County resident. And the contact tracing extended both within Picking County, but also within Eagle and Garfield counties. And then those counties have picked up contact tracing for the individuals that are identified from that individual. Just to give you an idea of how, once we had the testing, identified the positive, had that person isolated, we actually have identified 17 individuals from our one case who were considered to have contact that would put them at risk of infection. And so they are now in quarantine and being monitored by our contact tracing staff. Similarly, in Eagle and Garfield counties, the same thing happened. I don't have their exact numbers here, but it's a total of about 50 people now that are in that contact tracing. So you can see how quickly it gets complicated. But it's also good that we were able collectively between the three counties to jump on these cases quickly, and this is an example of how we stop the spread. And so obviously if you have more cases, that level of complexity increases. Would you say logarithmically? I can't remember the right term there.
Can I ask a question?
Go ahead, Patty.
Yeah, so you identify and then you isolate or quarantine. Is there a period of time frame? So you say your contact was 5 days ago, for example. So your quarantine will be X amount of time, or is it automatically 14 days, or are they tested, or test results come back positive, then their quarantine is the 14 days, or if their test results come back negative?
I want to confirm this with Karen, but I think it's 14 days from the time of contact.
And are they
to
tested
see if they're
when
symptomatic.
we identify them?
If they become symptomatic.
Only if they become symptomatic.
Yeah, now we are working on potentially asymptomatic testing, but right now the PCR tests are most effective with symptomatic. So we're watching for symptoms
And
during the quarantine.
Do we have a turnaround time for today's PCR testing? Is it still 3 days,
24 or
40?
48 hours,
so it's
but we do
improving.
have the rapid PCR testing. Actually, that's starting this month, which will be about a 45-minute to 2-hour turnaround.
I think it's hard for people who may have had contact with someone to then say, thank you very much, now you're quarantining me, I can't go to work, how long do I have to be here, when can I be tested, and so I think it's to have that information out to the general public that it's not this life sentence, it's in the benefit of yourself, your family, your friends, and the community as a whole.
Yeah, absolutely. So we did have 2 other cases that showed up on our report if you've been watching the dashboard. And you'll also see a negative one because one of those cases actually was in another county. It wasn't ours. And then we do have one additional case here. So we have added 2 cases, netted 2 cases.
So that was the one from last week that was the one person who worked elsewhere, was tested elsewhere, and then we have one who's within our community?
Who was tested here at AVH, was visiting, but lives somewhere else and had already returned home. So that number went there.
Okay.
That's why you have a negative one.
Okay.
Okay. The other thing I wanted to chat with you about a little bit, if I can get this to, were there other questions? I'm sorry, Steve.
Greg has one.
Yeah, John, just want to make sure I'm clear with the dashboard. You know, it's interesting. The rumor mill has cases popping up and down, and I'm not sure there are cases that were reported on the voluntary. I'm not sure there were cases that confirmed or even if they were tested. For instance, there's one individual I know in the Valley whose doctors say they're sure they had it, but they were tested negatively. Is there a tracker for, you know, presumed positive cases that may not be, you know, they're showing negative, but the doctors told them, hey, we're pretty sure you have this. Why it turned out negative, you know? So the thing is, if we can't accurately show this, it kind of gives us a sense that we're not really connected. And I'm trying to rationalize what I'm hearing on the street through the grapevine with what I see on the chart. And sometimes it just doesn't seem like the chart's able to track what I'm hearing. And maybe it never will be able to, but I guess if the doctor has to report it, or the individual has to report a symptom voluntarily, or there has to be a case at the hospital, or they're not going to show at all. Is that correct?
Yeah, we're reporting the positive test results, Greg. So everyone who's symptomatic can be tested and should be tested right now. So the presumptive positives where, symptoms may be getting identified and such, those aren't being reported. We don't have a good mechanism for that information, but we are very clear on the testing results. And I just say for anyone listening, if you have symptoms consistent with COVID-19, contact your primary care physician or Aspen Valley Hospital primary care, and you will be able to get a test. And that is the best way we have to know if it's really COVID or not. I don't know if that answers your question.
I think that answers the question. I was just thinking if there are people who are convinced they have it, even though the test says it's negative, and you just wonder, is there a database that says, there are X number of people who think they have something like this in the community? Just wondering if that would be useful.
Can I just jump in? I mean, I think that's part of what the point of our symptom tracker is to provide that place for people to report, their individual experiential, evidence that may differ from what the test result is. And that has, I think, proven to be a useful, at least gauge for how, what the outbreak looks like in our community. And, it helps to keep in mind that these cases are reflective of behavior from 2 weeks ago, or 10 days ago. And so we do just have to know that there's a lag and that, we may see more because we've done more and everyone's done more over the last 2 weeks.
Good point.
Yeah. So anyway, that's just,
it's a good point. And I think really it comes back around to us encouraging the public to sign up on the voluntary symptom tracker. Because if they don't, we really don't have, maybe that's all we can do. But I'm frustrated with it because it seems like not everyone will do it, or, you're never going to get 100%
Yeah.
saturation on it. Thank you.
So, John, I have a question or a concern. The reports are there are so many people who are asymptomatic who actually have the virus. And when we're doing our contact tracing, I think we need to assume that some of the people who don't come up with symptoms will actually have the virus. And they may or may not be able to pass it on. If they don't have symptoms, maybe they don't pass it on to someone else. But I am concerned about the possibility that asymptomatic people don't think they have it. They do some quarantine time, but they're maybe not quite as careful as they should be and end up passing on to other people. So if we can come up with some sort of a system, I don't know what it is. If they do the full 2 weeks of quarantine and are really good about it, then I guess the virus doesn't get passed on to somebody. But if they're at all careless, thinking, I'm not getting sick, I'm not having any symptoms, I don't have it, they get more careless and then pass it on to someone else potentially.
Mm-hmm. Now, and that, Steve, that is why the contact tracing is really about identifying those who have had a contact that would put them at risk of being infected, and so they may be pre-symptomatic or asymptomatic at that point, which is the purpose of the quarantine for 14 days, to see if those symptoms develop or not, and to prevent anyone who's pre-symptomatic from spreading. We are doing regular check-ins with these folks, but it is true, we are not there 24/7 watching. So we really do rely on our community members and those who are at risk of being infected, complying with these quarantine and isolation orders and rules, so that we can slow or stop the spread of this virus in our community. We are doing check-ins, though.
Are those check-ins everyday thing, like a phone call from a contact tracer?
It's not typically every day. I can't remember the exact schedule now, but they have a set schedule where they're checking in and making sure that the individual's needs are met to be able to do quarantine and that sort of thing.
Okay. So you have more on the COVID-19?
Yeah, so I do want to talk a little bit about one of the funding sources that's being considered now for distribution by CDPHE. Staff would like to be able to make a few comments on the county's behalf regarding distribution, and particularly what we're talking about is, well, I guess it's ELC. I transcribed it on the ELC funding, which is epidemiology and laboratory capacity funding for prevention and control of emerging infectious diseases from the CDC. This is one of the pots of money we did talk about last week. So far, the state has received approximately $188 million in these funds. They have a pot for enhanced detection of just over $159 million, and these slides are from CDPHE presentation. And this funding is being divided amongst local public health agencies and then other funding priorities by CDPHE, and they are going to be making distribution decisions this week. And so we'd like to be able to weigh in. These funds can be used for workforce capacity, which includes lab staff, case investigation, contact interviewers, outbreak response, infection prevention, which is what we had called the consumer protection last week. We don't like the word surveillance, but that's a word that CDPHE likes to use. Information, data analysis, project management. And so clearly the appropriations that the board made just last week squarely fall within this funding. Right now, how CDPHE is looking at dividing this $159.5 million is roughly $67 million for state lab capacity enhancements, $55 million to be split between local public health agencies, $9 million for CDPHE workforce, $5 million to go to tribal governments, and $23 million for indirect costs. We have some concerns that I think are shared with some of our other mountain neighbors that we'd like to forward up to CDPHE today or tomorrow before they're making these allocation decisions that we'd like to run by you. First is the $23 million that's being taken off the top for indirect costs. This is typically based on a cost allocation plan. You all are familiar with those. We allocate costs associated with providing accounting, HR, facilities type services to departments. The Colorado Department, CDPHE has entered into an agreement based on a cost allocation plan with the feds for a percent that can be charged for indirect costs. The challenge is as grant dollars go up, as they have been with the CARES Act funding and this type of funding, you generally see better economies of scale. You don't scale up staff at the same rate that you typically scale up the zeros behind a grant, right? And so CDPHE had communicated that they were looking at an overhead rate of 2.3%. And so 2.3% of 159 million is actually just over 6.6 million, not 23 million. So it is unclear to, and that seems more reasonable in terms of costs to administer a grant of this size. And so we would like the opportunity to pretty quickly raise concerns about the amount of indirect costs and ask that funds be redistributed, frankly, to local public health agencies where, frankly, most of the burden for case investigation, contact tracing, disease prevention, and frankly, testing, which will be the next piece, is really falling to either local public health agencies or healthcare systems, not necessarily to the state. So we would like to argue for a little bit larger reallocation of funds there, particularly from the indirect. The other concern, I think that staff here as expressed, and we have some agreement from other mountain counties, is the $67 million for the state lab. This appears like it would increase capacity in the state by about 1,800 tests a month. 1,800 tests a month. Right now, what we're seeing is that most of our testing for most communities is being done either by local hospitals or local healthcare systems, and for the most part, private labs or rapid tests like the rapid PCR tests that we're looking at using. are now what's being used to provide the testing capacity, and the state lab is generally used when demand on the state lab goes down and their turnaround times go up. And so it's not clear that right now building capacity on the state lab side makes as much sense as maybe working more with local communities where they've been using the private lab capacity, and that it would probably make more sense to fund the prevention and case investigation, contact tracing, which again is falling primarily to local governments and not the state. So that'd be the second point in the distribution that we would like to raise with the state. We're probably a little bit late in the game for both of these right now. And then the third is the distribution methodology. The state had proposed a straight per capita distribution, so based on census population. We would recommend two things, actually. First, the Colorado Association of Local Public Health Officials has come up with a distribution recommendation that they're sharing with CDPHE that includes a base amount. I think theirs is set at $250,000 that would go to all local public health agencies regardless of size. And then on top of that, you would do the remainder of funding on a per capita basis. That benefits the smaller public health agencies, and it makes sense because there tends to be less economies of scale. The smaller your organization is, the harder it is to scale up capacity than when you're in already a larger organization that tends to have a deeper bench. And so CalFO is recommending a base amount. It is somewhere in the 200, I think it's at 250 now. They're looking between 250 and 300 for all local public health agencies, and then do a per capita. CDPHE was recommending a straight per capita, which would not benefit the smaller and more rural communities. So we'd suggest supporting CalFO's recommendation. Staff had also recommended to CDPHE that they consider using, instead of census population for the per capita distribution, using Bureau of Labor Statistics numbers on the number of jobs, which would be an indication of activity in a community as a basis for the per capita.
Yeah, that,
So.
Steve, can,
And that's all I had on that. So.
Steve, can I ask a question?
Hey, Patty?
Yeah, that was gonna be my question. One of the situations we find ourselves here is that we have a census population here, but we have a seasonal population or a visitor population or economic issues that bring up our population, which definitely hits us, and that's where it throws it off. So you may have more people that live, in Broomfield, but you have, what's your population that visits or guests or second homeowners in the mountain communities. So I think, and of course supporting CalFO, who is the Colorado Organization of Public Health Agencies, makes great sense. I mean, they're the ones that have their boots on the ground, and they see it right now. They're literally seeing it. So I don't have a problem with any of these. And of course, we know how Pickens County is being received at the state level for some reason these days. We need to be very careful, but I think we still need to voice our concerns, our comments, and our suggestions. Carefully.
Greg?
Yeah, thanks, Patty. I just want to agree with that. I was thinking that regarding when we have our tourist influx, whatever that will be in the next year or so, but also these people that we have coming in are coming from all around the world, or had been, or at least all around the country. And I'm hoping the mountain communities and the resort communities are getting the point across when we're asking for the allocations of these funds, that we're on the front lines. We're a port of entry for the state, and so it might make a lot of sense to have some of those resources focused on this. We're not a sedentary community by any stretch, and I'm hoping that that's reflected in the ask and that they understand that. Thank you, though. This looks good to me.
Okay, Kelly?
Yeah, thanks, John. Gosh, of course I support this. I hope needing to meet with us hasn't slowed you down. I know this question came up in open discussion. I did reach out to CCAP, but I actually did not get a response back from them as to whether this reflects a negotiated settlement similarly to how the $275 million from the CARES Act did. I'm guessing that it doesn't. So, you know, there's a real patchwork of approaches here and how local communities are getting funded despite the fact that we are the frontline response. And I'm just hopeful that the state can kind of streamline how that works and pick some approaches that will be used fairly and across the board so that communities who continue to have cases like ours will have the resources that we need to respond. And so I'll also just reiterate this request through our networks as well, with the hope that it gets heard.
Be great. Okay, and then of course I can never leave one of these two with just.
John?
Oh, I'm
I
sorry,
have a
Steve.
question,
Yeah.
John. On this request, are you sending a letter? How are we getting in touch with the state and forwarding our concerns?
Given the time frame, I wanted to confirm with you guys that you would support this approach. I'm trying to coordinate, frankly, an email with some of our other mountain counties just to go out because I believe the decision's going to be made in the next day or two, unfortunately. And you guys didn't slow us down at all. We just got this information a day ago. So we'd like to get it out quickly. And Steve, if you're okay, I'd send it representing that we had this discussion with the board, and I can put your contact info on as chair.
So Steve, I have a question. Are
I
we
think
gonna
you're muted, Steve.
Go ahead, Patty.
Are we gonna submit our own, or are we gonna tag it on with the other counties? It'd be great if we could do it with the other counties that were supporting it as we are, so that our
Yeah.
name is listed with them.
I think we're going to write it and ask the other counties to join.
Well,
us.
whichever.
Yep.
That would be great, because I think for us, we need to do it carefully part of it.
Yep.
I think that would be, it also carries more weight when you have the counties all standing together on the same issue with the same concerns.
Yep.
Yeah, so let's just do a thumbs up. Is everybody okay with John sending an email in conjunction with the other mountain counties? Let's
Whatever
just do a
is
thumbs
decided.
up to make sure. I think we probably all are good on that.
Okay. Excellent.
Okay.
And I just never want to leave any of these for members of the public who might be watching about really the 5 things that we can do are maintaining 6 feet of distance, washing hands often, wearing face coverings in public, staying home when sick, and getting tested when you have symptoms. And if you do have symptoms, call your doctor. If you do not have a primary care physician, you can call 970-279-4111 to get referred for testing. There are no walk-ins, no health insurance. Cost is not going to be a barrier. We want you to be tested. And that's all I have for you for the update today.
Okay, let's see. We are scheduled for a break at 2:30. We
Yeah,
could
you gotta
go
wave it,
in,
Kelly.
start our,
I have a few
Kelly?
COVID-related questions for John.
okay. We will continue on COVID-19 related issues.
Yeah, just.
Go ahead,
yeah,
Kelly.
we have 10 minutes and I have a couple questions. I just was wondering what our compliance activities are looking like in terms of our staff's outreach and
Yeah.
what they're hearing is one question. And then another one is, have we heard about schools? Do we have any crystal ball as to whether
Ooh.
schools will open or not in the fall. And I think that's it.
So neither of those are easy. I guess the schools, I know the schools have been doing some contingency planning. I think they are also waiting for guidelines and such from CDPHE. And as you know, the schools here are going through a leadership transition that's going to be happening this month. So I think we'll be hearing more over the summer as we get more information from CDPHE. My understanding is there's a range of options being looked at. We've the school year this year finished online. A number of school districts are looking at hybrid kind of options where you reduce the density in the classroom by having a combination of online and in person. I don't think we have an answer where that's going to fall yet.
Can I just clarify real quick? We received a letter, I believe, from somebody who thought it was Pekin County Public Health. Our decision. It's really not our decision. If the schools decide to open or close, we can discuss things with them, but I think it's really up to the school, CDPHE and the school districts themselves.
Yeah, and so they're definitely critical infrastructure, and the school, just like with graduation, had independent guidelines from the state to follow, and that will continue.
Right, just for clarification, so the public is aware, the Board of County Commissioners will not be deciding whether or not to open schools.
Now, the school district does confer
We'll be
with
talking
public
with them.
health and absolutely seeks advice and guidance, and they've been a really great partner throughout all of this.
Wanted the public to be clear on that.
As far as compliance goes, we're hearing a number of things. We obviously had some cases that were in the paper that we've been following up on, and obviously taking our compliance, seeking voluntary compliance first, and escalating as necessary into enforcement actions. We've had good cooperation with our municipal partners in helping us identify more difficult areas around compliance so we can have those discussions. We also need to build our staff, and thankfully you all did approve us doing that. It's going to take us a little bit of time to get our consumer protection staff in place. We've had great partnership with the City of Aspen and their employees in helping us build out that compliance process. And so we do have some enforcement issues that are ongoing right now. Obviously, these are interesting times, and so we have a really critical community dialogue going on around race, and there's a certain level of civil disobedience associated with that, with the demonstrations and such, and social distancing probably has not been followed as much at the demonstrations. We are trying to figure out if there are ways, whether it be kits or information or more dialogue with the organizers, that we can better coordinate our public health needs with the need for the community to have this dialogue. So that has been a pressure point, and I know we've heard from our community on both sides of that issue. I don't know if that's answering your question, Kelly.
Well, it does help. I mean, I was interested in hearing what our kind of presence on the ground is to monitor, and I know our municipal partners have been helping with that.
Yeah, and until we build our staff out, right now our consumer protection, so like our environmental health staff is actually really prioritizing the contact tracing activities. They're taking lead on that, and we really are relying on our partners until we get that consumer protection staff hired.
Sure. Okay, but it's not a total void.
It is not a total void, and like I said, our partners have been great, and we've been able to act on those most egregious cases.
Okay, George?
Yeah, just to follow up on Kelly's point, I mean, I frankly think that our social distancing is thrown out the window. Especially, I noticed over the weekend, I was up on Independence Pass, and people, not necessarily locals, but there was a tremendous amount of out of county area people, and so I don't know. We really can't do much about that. The only thing I can think of when I passed North Star on the way back down, or hearing stories about smuggler, to be able to ensure that our open space and trails rangers have the authority to be able to follow up, educate, communicate, and if necessary, ticket and fine people, because I think it's become very lackadaisical as now more and more businesses are open, restaurants are open, retail shops are open, people are coming in from out of town, and they have their own set of rules or values, and it's not equating with what we're trying to accomplish here in Pickton County. So it's a problem, it's an issue, and I know it's a challenge, but it's not going to get better as, I mean, this weekend, you could not find a place to pull a car over from the top of the pass all the way down the bottom, so.
And we are working on some marketing campaigns really targeted at our visitors and folks outside the community. I think the residents who have been here over the last 3 months have really probably seen the message. And I think we're seeing good adherence in a lot of regards in a lot of places. And I think you're right, George. Our challenge is, as we have more visitors coming into the community, how are we getting the message out to them? So we are developing a campaign. We've put information resources. Patty, I know you brought some down to Woody Creek Tavern.
And handed them out to different places of business for them to post, just to reiterate the points of the 5 commitments of containment and education, both in English and Spanish. I'm asking them to share those with their visitors and guests.
And I'll just go out real quick just so you can see. Under business resources, we have communications resources available for anyone who wants to use them. Sorry, the internet's running a little bit slow. It must be the cold weather. But all of our posters around the 5 commitments, they're in English and in Spanish. Testing, masks, being outside. So we'd really encourage our local businesses, any organizations to download and post these resources, especially where we might have visitors, and to please post them in English and in Spanish.
And the other good thing about them is it also has the website information, so people can be directed. It's just getting people to actually read them. So that's why I told businesses and places that, I know you have this sign up here, but you have to put them where people are sitting waiting to get in or waiting to get a table, and spacing, and a place where they can actually sit and read this information.
And so, yeah, we're going to have to continue to be persistent in getting this message out and focusing on those 5 commitments. And George, I agree, there are some places where they're being followed better than others now.
Steve, I have another quick question, though. Tagging on to George, do our rangers have the authority to enforce public health mandate violations, though? They can do, per our Home Rule Charter, certain things, but they can definitely educate, but I don't think they can actually fine, or I don't think they can do that for the public health mandate violations.
Yeah, it really comes through the attorney's office and the authority and our public health staff. But I do know the rangers have been out doing education and out encouraging the social distancing and compliance with those rules.
Thank you.
So, John, my concern, tagging on to what George brought up, we are going to have this virus that's going to blow up in our county sooner or later. And the state has, with our variants that we got, there was the number 18 cases. I don't know if that was 18 cases in 18 new cases total, or is that over a month's period, or what? How does that number compute?
I'm trying to remember if it was 1 week or 2 weeks.
I thought it was 1 week, 18 cases per week.
Yeah, I'll have to pull the variance up, Steve. Is either 1 week or 2 weeks of 18 cases. I think our concern would kick in well before that. The most that we've had in 1 week was our first week with COVID, right, where we had the 10 confirmed cases and then the 3 presumptives. And, you know, our concern kicks in before that, but we are watching the hospital numbers very closely and the testing numbers, and we are still, our data is still good. We are going to have more infections as we reintroduce activities and we have lapses of compliance with these 5 commitments to containment. We will reintroduce infections. The real key is, are we introducing them at a rate that our healthcare system and community can absorb successful? And as long as that's the case, that's really our goal here. We're probably not going to stop it entirely, but can we slow it so that our healthcare system continues to have the capacity to be able to safely serve people who need their services?
And I think on a medical level, I think we saw it before the snow fell just recently. We saw an uptick in allergies and asthma conditions based on our normal seasonal allergies. Cottonwoods were just starting to fly again the other day when I was doing my walk. And I've been talking to people who have seen that uptick, been going to their doctors, been tested for COVID and testing negative, but based on the fact that they have seasonal allergies. So people need to understand that because you normally have seasonal allergies does not mean that you don't have symptoms of COVID. So you should still contact your physician just to discuss your personal health issues, just to be clear, and as best certain as possible, which is not always a definite negative or a definite positive.
Yeah, and then to finish my thought, John, at some point we might lose our variance, but at some point also our variance is going to be what the state guidelines are anyhow. It won't be a variance anymore at that point. I don't know if we have reached that in terms of what the state guidelines are for everybody. Do you have a grasp of that?
Yeah, the state continued, Steve, the safer at home, and they've added a tagline that I'm about outdoors. I'm not remembering right now, but the key elements they've kept pretty much the same. They allowed the limited reopening of restaurant facilities, but group and event sizes are still limited to 10 people. That will be through the month of June, and they will reevaluate it in July. So our variances, we still have more flexibility in a number of areas where we're reintroducing some activities. We are moving slower than some of our neighboring communities. We've done what we're calling the phase within the phase to reintroduce activities in a staggered way. So you have phase 2.0, 2.1, 2.3, where we're reintroducing new activities with guidelines versus all of them at once. It allows us to have some tracking and to have some incremental steps where we can slow down if necessary, hopefully without having to take a big step back. So we do still have more flexibility than the state. We're implementing it in a measured way, and yeah, and we'll continue to evaluate, and we'll see where the state is in July.
Okay. Any other COVID issues that people want to bring up right now? I'm not seeing any, so we're scheduled for a break, and it ends up being like a 10-minute break. Let's take it up at 2:45. Take a 10-minute break right now.
Great, thanks, Steve.
All right, Grassroots, back at 2:45. Thank you. session now. Hi, good afternoon. Welcome back to the Board of County Commissioners work session on Tuesday, June 9th. We are going to enter into a board open discussion, and I'll turn it over to our chair, Steve Child.
Okay, John, what do you have that you want to bring up today?
You know, we had a couple of items. Janice was going to provide an election update, but we thought that Sorry, I didn't have my mic on. We were going to provide an election update, but we thought that would be better during public comment tomorrow, as more public maybe watching. Otherwise, I think everything is really around future agendas for me, so we can see if the board has any open discussion. Steve?
Patty?
Yeah, I have one, and it would be great if we could maybe address it and move it forward to add it to our agenda for tomorrow. I think the information was passed along to you from Charlotte. It's about our project with Basalt Vista, with Habitat for Humanity, and with the Roaring Fork School District in Pitkin County. For the rest of the board, they had a restructuring of the Homeowners Association board for Basalt Vista, and our good friend John Ely remembered that at a meeting some time ago, I had said, well, if no one else is interested, I will step in for the county seat on the homeowners board, which I did. And we recently had our first meeting, and part of that meeting came up the discussion about the park area as part of this project. It is a park area that's being constructed and will be maintained by the homeowners, but it is a public park. And it is a public park in Pitkin County that Pitkin County will not be responsible for maintaining in the future. So they had applied for a Great Outdoors Colorado grant. The grant did not come through. So they were trying to figure out how they could raise money or whatever to do a play structure in the park. And I got to thinking about some opportunities and remembered that Pitkin County has a parks fund dedicated to public parks. The balance in the fund right now is around $135,400. We have about $40,000 that still needs to go to a Coke Ovens project in Redstone. So that's going to leave us with a balance in that fund of $95,000, with a significant amount of money that's being held in escrow related to the land exchange with Wexner at Two Shoes. So I would like to ask the board if the board is comfortable in appropriating $30,000, which would cover the play structure and installation at the new Habitat for Humanity Basalt Vista Park. And I don't know if you got the letter from Juan. Juan, Kelly lives in the house that we worked on. That's the first house that people moved into. He drew a great rendering of his perfect park, which has everything you can imagine. But all we would be funding would be for the play structure and installation. And I think it would be great if the board would support putting that on our appropriations item agenda, possibly for tomorrow, moving it forward so they could get the ball rolling and they have the park in so the kids could utilize it hopefully sometime later this summer, early fall.
And just for the board as a reminder, park dedication fees were collected really for exactly this kind of purpose. They are a development exaction. We do not collect them anymore, but we do have as Patty has laid out, a fund balance available. It is a restricted fund balance, so it can't be used for purposes other than park or park-type facilities to support new development within Pitkin County. The money's in escrow. There's $350,000. That's an escrow that will come out of escrow into the Parks Fund at the conclusion, once the final approvals of the Wexner Land Exchange go through. So that's the other part.
And how many, I have a question.
Kelly?
And how many people are beating down our door with requests for park funding?
Not a whole lot. We've we used it for Redstone at the Elk. Now I've forgotten the name of the park. Right in Redstone, the open space and trails.
Elk Park.
It is Elk Park. Okay, I just forgot the park part. We use some, I think, on the bridge near Lazy Glen. And then we've talked about using some of the monies when they come out of escrow for the Whitewater Park. So there's been no requests against the 95,000 that's left.
Okay.
Yeah.
George?
I would see that down the road we may want to utilize some of those dollars for public park at Phillips Trailer Court. So I don't have a problem with the request. My only concern is what happens if it goes over 30,000. Are they going to come back to try to finish that up? And is there any was there any requests going into the Roaring Fork School District just to help, since half those units are for the Roaring Fork School District?
I'll respond. No, we did not talk with Roaring Fork School District. I thought about this after the homeowners board meeting where the Roaring Fork School District representative was there. But that may be something we can roll into if there's future costs. But they have such a strapped budget right now with the school districts. I'm not sure that would be something we could look at now, but maybe we could bring that into the discussion with the board, with Gail Schwartz, who's chairman of the homeowners board, that if it overrides, I think it's pretty much, they really researched it with their GOCO grant, so I think they know that this is the amount they're gonna need, and anything that would come above that, they would look for other funding sources. They would not be coming back, and I can make that clear. And I think they'd be very accepting of whatever we would offer to do, but I think this would be huge for that community. And the fact that it's a park in Pickens County and we don't have to maintain it, such as Elk Park, where open space is really responsible. We had a long discussion about that. So I think this is a great opportunity. And George, you're right, this is a good example to be used then if we wanted to roll it over to Phillips.
So, I would be in favor of putting money into it also. I'm never have been totally sure about the difference between the park money and open space and trails. Kind of does parks and puts money into parks at some time, but they're really more rural kind of parks as part of open space is more where they put their money in. And I gather that the parks money actually goes into more urban or high intensity kind of public parks that people think of parks. Is that correct, John?
I think that's roughly the intent, Steve. I don't think it's spelled out. It's really to support park and kind of recreation facilities associated with development. So that would link into more suburban type areas like what you see in Redstone.
Mm-hmm. Okay. Greg?
I was just concerned when somebody says it's a one-time cost and we'll never have to put money into it again. That makes me nervous. I guess I want to learn more about the cost of this, what we're going to be buying, who's going to be taking care of it. What's it going to look like in 5 or 10 years? What issues are going to stay with this going forward? I know we've put a lot of money and resources into this already, and I can imagine we'll be getting requests, as some people said, from Phillips and from other locations for parks. So I want to learn. I want to know more about it. I'm sorry I don't know as much as I should on this, but I think it sounds good. I guess we'll be hearing more before it comes back, where we have to actually vote to approve it.
Patty?
Yeah, well, the problem is we'd like to get it moving, and our only chance in the next 3 months is tomorrow. So I can see if Gail Schwartz can provide me with the actual, Pickens County did support the GOCO grant, which was for the park and play structure. The play structure, we will not be maintaining it, we will not be installing it. As far as long-term, we can make it clear that this is for the play structure now, and they last a long time. City of Aspen's play structure down at Heron Park has been there for many years with little, if any, maintenance to it. But I think your concerns are valid, Greg. But again, and what John Peacock said, this is a perfect use of these parks funds that are sitting there. because they are so restricted. We've had lengthy discussions. We almost did not approve their use for Elk Park in Redstone because of, was it who's going to maintain it in the future, and the same thing with the bridge at Lazy Glen. So I think if any use of these funds are clear, it's this one. And I will see if I can get Gail to provide me with more information for tomorrow's meeting, but I would like us to consider putting it on tomorrow as part of appropriations, or either that or we have to wait 3 months. And
Great.
that'll be the end of the season.
Yeah, Greg, would kind of a drawing or such, if they have a layout for the
There is-
playground and such, because I think it's mostly equipment and probably landscaping.
No, it's just for the, it's part of
It's
the
just for
memo
the
that Gail
equipment.
Schwartz sent, and I think you all received it from Charlotte. There is a photograph of a typical play structure.
Oh, it's just that. I'm
It's
sorry.
only the
Okay.
play structure that we are going to be responsible for.
So we're buying the play structure, then
And
they
the-
install it and maintain it
We're
from this
doing the
point on.
installation, we're doing anything associated just with the play structure. They will maintain it in the future as part of their homeowners. It's written in their homeowners, their homeowners, what do you want to call them, documents, that they are responsible for the homeowners association and the maintenance of this park, even though the park is public and open for public use.
Got it. And then the surface beneath the play structure will be thick, loamy, soft. So,
Yeah, I don't know if they'll
soft
use-
surface.
Yeah, if they use that rubberized stuff or if they're going to be using bark, I don't know the specifics of that, but we are responsible for the structure itself and the installation.
Okay, I'd love to hear more from Gail, and I'll review what Charlotte sent, and I'll.
Let me know if you have
I'll
any
probably
questions,
get
and I'll
thumbs
kick
up
them over to
tomorrow.
Gail, or you know how to contact Gail yourself. You can always give Gail a call. Anyone who has more questions, more specific, Gail is more than happy to speak with any of us about this.
Thanks.
Thank you.
Okay, thanks, Patty.
So I have a logistical question. then.
Any other?
Can I just ask John, if we decide to, we can do this at the beginning, do we have to have anything, if for us to look at tomorrow as part of our agenda packet, as part of our supplemental appropriations for this quarter?
I think you can add it on first reading and be subject to public hearing on second reading, and we can add it into the materials then.
Okay. Fine.
As a second quarter supplemental.
Yeah, that would be great, because then they could get it working, so we could get it in before the snow flies by tomorrow.
And just checking in, that's a that's the board's direction to staff to go ahead and add that. We can add that in.
For further discussion, great, thanks. And I'll reach out to Gail or Greg, let me know, call me later, or send me an email if there's specifics, and we can flip them to Gail, and I know we'll have answers before noon tomorrow. Thanks, guys, appreciate it, a lot.
Okay. And Kelly and George, are you both good with that? Greg and I are both good with it.
Yep.
Okay. All right, we got all five of it. Further board discussion? I know, go ahead, Greg.
I was just going to say I wanted to call everyone's attention to the CCI correspondence from John Swartout regarding the temperature scanning devices that the state has. I guess they're doing a test with 3 counties as a way of maybe predicting where outbreaks of COVID-19 could be. And I found this pretty interesting. I've been following, tracking, and tracing technologies and protocols. It sounds like the state has adopted something. They're going to test it in 3 counties. My question is, in a county such as ours with a lot of transient tourist activity and other people coming in, might we try to, look at that as well? So I just wanted to give everyone a heads up to read that email from CCI, and so we all know what's happening there. Maybe there'll be a use for that here. Might be a way of helping us maintain a safety and a sense of security for people coming into our community.
Kelly?
Yeah, thanks. I have a couple of things. First, I just want to check in with the board on meeting preferences. So I think Steve and I in our Friday agenda discussions added the exec with items for the afternoon. And I don't know if the morning or the afternoon is preferred by the board, and so I thought I'd ask.
Go ahead, George.
So I think that if we're starting at 10 a.m., then I would like to have the exec in the morning. If we're starting at 1 o'clock, then it makes sense in the afternoon, because that way if we go over a little bit, and I don't have a hard end time today at 5:45 either to get to the topic. But that's what I would suggest. In the morning, if we're looking at a full day, and the end of the day, if we're looking at a shorter day.
Thanks, George.
Patty?
Yeah, I agree with George. And to me, it doesn't really matter. The only date that we can't do them in the morning really is the date of the ACRA board, which is the fourth or the last Tuesday of every month. We have ACRA board meeting, so that's why our agendas usually start at 11 on Tuesdays. That Tuesday, the last Tuesday of the month, if we have meetings that last Tuesday of the month. But we don't always have a regular or work session meeting, so I'm good with them either ways. I understand when we go over, but we need to be reasonable when we go over, because some of us do have things we need to do after work, like fix dinner for others. But I'm pretty flexible with it. So whatever happens to work with the agenda is good with me for the most part. Thanks, Kelly, for asking.
Mm-hmm.
So one thing that happened this week, John Ely realized he needs to be gone next week, and so we needed to do an exec session this week, and it started out with just a couple of items on it, and that just ballooned into everything under the sun because he was going to be gone next week. But we don't have to do everything in the exec session today. Some of them are not as important. Some of them are important today.
And then, Greg, do you have a input for us?
So
I'm fine with whatever, whenever.
Kelly, I wanted to bring up the CC 48 item, just at least briefly. The thought crossed my mind. I read through the whole CC 48 proposed policy, and then I found one item that I think we should request that be added to it. I think it might be better if we request that earlier than next week, which you were suggesting, Kelly.
Mm-hmm.
So if it's all right with you, Kelly, I think I'll just run that idea by everybody right now. We don't have to necessarily decide, but we can be thinking about it and where to put it. So the CC4CA policy, which Kelly sent out, has been greatly edited to make it much more compact and simple. They took out all of the explanatory kind of paragraphs that filled up the bulk of the policy. The part that I would like to add, or I think we should consider adding, and we all have to decide on this together, but in the number 24 item, it has been reworded to say reduce the use of disposable single-use products and promote the reuse of materials. The original text of that also talked about construction and demolition waste, which of course is a huge part of the waste in our landfill. And I'm suggesting that we would add either a number 25 after that or another clause after the word reuse of materials, and put a comma and say, and the repurposing and retrofitting of buildings, which is kind of a reuse item, but I think it should be called out specifically because whenever a building can be repurposed and not totally torn down, that is making use of a huge latent energy that is built into the construction of the building that's there. And it really has an enormous energy component to that if someone and repurpose the building like we did with our county building.
Yeah, I think that aligns with our,
Probably would have been easier to tear the whole thing down and start.
yeah, I would offer that.
Maybe we could think about it, we could
And I was planning, for the rest of the board, I was planning on touching base with everybody during our board reports next week, on the 16th, about the policy statement, to get any input, because the CC4CA board retreat is on the 19th, which is when they will adopt it. So you'll have some time to chew over Steve's suggestion and anything else you might want to offer, and I'll bring it back at that time.
Okay. And I was thinking we could send this wording out. I mean, if we all agree to it, send it out to the other CC4CA towns and counties now, so they could be thinking about it, whether they would like to have that added also. Sure. Because everybody, all the different entities have to approve of this. If any item is not approved of, then it has to be a unanimous approval, but people can live with the policy statements. And so, is everybody all right with adding that language, something to the, having to do with repurposing and retrofitting of the existing buildings?
I'm good. It supports what we've been doing, so.
Okay.
Thanks, Steve.
And I think, what I could do, Kelly, is I'll just email you the language that I came up with. You could edit it and send it on then to CC4CA.
Great.
And we can get it to people a week ahead of the policy, the annual meeting, instead of the day of. I think would be better strategy. Okay. Any other open
I have a
discussion?
couple. Yeah,
Kelly?
I have a couple more things. I'll try to get through at least two of them quickly. One, I just wanted to, the legislature is moving very speedily. I think they are set to adjourn on Friday, unless that date has been moved again. But, they have taken up more than just the budget. And one of the things that I want to touch on is the what they're called the school entry bill. And this is a bill regarding vaccination requirements. And we talked about this, I think, earlier this year, and sought Karen's input, and Calfo supported this, and Karen supported the bill. It had an uncertain future until recently, and what it does is it makes it more difficult. One of the more meaningful things is it makes it more difficult for people to request non-medical exemptions for vaccinations. So for a person who's requesting a non-medical exemption, they would have to meet with a public health or medical official to have and get a signed submitted form for their request, or watch a educational video about the importance of vaccines. Colorado is last in the nation for vaccination rates on some very infectious diseases. Pickens County has some very low vaccination rates at some of our child care centers for some very infectious diseases. And the exemptions that have been reported at our child care facilities are due to these non-medical exemptions, not an exemption related to a child's medical contraindication for vaccinations. So I just want to personally thank Senator Donovan, who voted in favor of this, and it moved out of the Senate, and then it's moving through the House, and Representative McCluskey voted in favor of this at committee, and so it is moving through the House.
Can I ask a question? Steve, I've been contacted by people who vaccinate for most things, but not for all, just by choice, and have been exempted and don't have a problem taking a class. I think it'd be difficult to put another onus on our public health department to have to start meeting with all these parents. I think the class, taking it online and verifying you've taken it, makes great sense. I think speaking with your pediatrician or your primary care physician for your children getting the education is extremely important for parents making this decision. So they're not just saying, I'm not vaccinating for this because of this, or I'm vaccinating for this because I believe it's one of the most infectious diseases. But they've had concerns about their privacy issue. Will it come out in any way rather than just a statistic? They don't want to be identified by someone who says, oh, you don't vaccinate your children. And I said I would believe that it would have to still follow HIPAA.
And all of these things are already reported to the state. There is a state database that is collecting vaccination information from physicians and from schools, that are reporting.
But it comes
this,
out
so-
statistically,
Right,
not
aggregated.
identifiable.
Yeah, and I don't
Perfect.
believe
That's what I
changing
have been expressing, but I said I would follow up on it, so perfect. Perfect
anything.
timing.
And, just, I hope Governor Polis signs it. Quite, honestly, when these bills were moving earlier in the year and introduced, he's a bit libertarian on this topic, and I hope that maybe there's been a change of heart and we can count on his signature on this bill. And then I want to touch base, so CCAT had reached out to Steve and I about taking a position on the police reform bill that you may have heard of in the news over the last couple days. We reached out to Joe DeSalvo because we wanted his input on that. I don't know if CCAT ultimately took a position yet, but Joe did give us information that I thought was really helpful. He had served on a body camera. Okay. Well, let's see. So I can see you all on my computer. I think Jordan is still pulling you all up so that you can be seen on the grassroots feed.
You can be seen
At
but not
home.
heard. This time you can be heard but not seen.
Okay.
Yeah,
Oh,
you keep
Mike wants
talking.
me to keep talking. Okay. All right, we're almost back. So, since you all can hear me, I'll just keep talking a little bit. But a lot of those amendments were incorporated into the bill that passed the Senate 32-1 today on third reading, and will move to the House. So I just wanted to report out on that, of just sort of our efforts internally to kind of figure out what what the county's approaches are and concerns, and I want to check in with any of you to see.
I think if we've got the
If
amendments.
CCAT is,
Yeah.
I don't know if they're lobbying on this because I'm not sure what the outcome was from the full governing board there, but to make sure if you have any concerns that we get those passed along.
I'm okay. Thank you for talking with Joey. I think that's important.
Yeah,
So-
Joey's two big issues. One was the cost of the body cams was quite a hefty price tag to that. And he was wondering if it's all going to come out of our local budget, or is there going to be some reimbursement from the state? And then the second big issue had to do with all the privacy issues about it.
Yeah.
Um,
And I think another amendment sought was that the requirement for police departments and sheriff's departments to provide body cameras was pushed out till 2023 to bring everybody into compliance and give time to budget for that.
And of course, this really is a response to all the turmoil in the country in the last 2 weeks, just because of police getting away with murders in way too many cases, where they're mistreating people they have in custody, and at least 3 different people now that I know of have been suffocated by the chokeholds and things of the police. And so this is really in response to that. Our legislature jumped right on it and, brought this bill forward very, very quickly, just in the last 2 weeks.
Well, and Steve, my last item for open discussion is, it's been brought to my attention, and that our memorial outside honoring our veterans includes a quote from Robert E. Lee and requests to remove that. For me, I think that our memorials should endure over time and should reflect our enduring values. And while the quote out there, I think, is, thoughtful and fairly benign, the messenger is not. And I would like to see us work with the veterans to have that replaced. And I know that you all have received the same communication I did, and so I want to check in with everyone.
Steve?
Patty?
Yeah, this is not the first time we've received that communication from that same person. And we discussed it at length at the time, and it is the Veterans Park. I think we definitely need to have the veterans at the table before we do anything to change. We were so careful to maintain that plaque and that center core when we did our construction of our new building. To keep everything intact was our goal. I agree with you on the messenger of this quote. I think the quote is exceptional. I think it portrays exactly what we're going through in this time and era. And I also am a firm believer in history, and that history has proven itself. We need to learn from it and grow from it. And I think that statement out there will carry over for years and years and years. And I'm sorry that the quote is by a certain person, but I don't think we should take apart our Veterans Memorial that has stood there for many years because of that person and take away that statement, because I think that statement holds more value. But I think this is a broader discussion. We definitely need to have the veterans at the table before we do anything to change anything at Veterans Park. But it's going to open up an opportunity for us to have this discussion.
Yeah, I think all of us have talked to John Peacock about this today or yesterday and today. And I would welcome having a discussion with the veterans to talk about the issue. I would also like to know more about the historic Lee made the statement under what circumstances. Also about the circumstances in, I think it was in 1987 when the park was dedicated, and that plaque was put on at that point. If there is any references in BOCC records or anything talking about what was going to be added to the memorial and what discussion they had about that. Whether we can find out in sort of that background information, I don't know, but I'd like to try to do that before we have the further discussion with the veterans.
Dan Glidden and Jeanette Jones and Colonel be the best bets. But I thank you, Kelly. I think that discussion needs to be had, and we need to bring in all those sectors. I would really appreciate that.
Okay, I would just,
Greg,
so maybe
do you
this
wanna-
leads us to future agendas. I don't know if I'm cutting anyone off from further open discussion, but I would just suggest that I do think that conversation should include some representation from our communities of color here in Pickens County to offer, what thoughts on a solution is what I would say. And so if this is something we're gonna schedule to add to our agenda and, I think find a path forward that does represent everywhere that we, values that can be agreed upon by all, that it should include, us and the veterans and communities of color in Pickens County as well. And, happy to work with John on
Yeah, I think it
putting
needs
that
to
together.
incorporate our entire community. I'm not going to specify any sector of our community. I think our community as a whole needs to be involved in this. And I'm hoping everybody feels comfortable coming forward, that we will respect their opinions and really have a thorough discussion. But then again, I have to just reiterate, we were so careful in preserving Veterans Park during the construction process and over the years that we really need to respect. And that would be interesting, Steve, to find out why they chose that quote. I think we have resources to find that out, and then that would really be beneficial, I think, in our decision-making process.
Okay, well, I appreciate your
No.
support on that.
Yeah, definitely. And I would call that a broader community discussion, bringing in many aspects of the community and giving everyone opportunity to participate and weigh in on it. Okay, let's see. I think we're done with open discussion. We have future agendas.
Yeah, and I have a few items for you. Next week, we're gonna have a subtraction and an addition. We are gonna move our public health update, mostly because our public health staff is focused on the contact tracing right now. I want to keep them focused there and not doing a presentation. But we do also have some special event proposals for drive-in style events. We're working on those guidelines this week. We're actually working on drive-in type guidelines because we had so many requests. So would like to roll those into a conversation with the board so we can get some direction, as it will probably involve use of places like buttermilk and such, where you need to give permission both to use the facility, but also we'd like to just get some general direction about approving these types of events going forward. So we'll replace the public health update with that, and we'll move the public health update maybe to the next week.
Do you have a question? But would not a discussion on special event permits based on COVID have something to do with public health anyway?
Absolutely, and so we're working on those guidelines, but fortunately that is a group that's not involved in the contact
Okay,
tracing, whereas
perfect.
the public health update
And
would
we
be.
should contact ACRA too to see if they've had any contact, because ACRA's really been working hard on different venues and sectors and events. So I think we should have ACRA's input, which should be great. And that same day, are we not having an exec session because Mr. Ely will not be available?
I believe the exec will probably be canceled because
Okay.
John's not here, but I don't know if Laura or Rye would have
Okay.
anything.
Just a question.
We're also going to add a proclamation for Garbage Man Appreciation Day, which is June 17th.
For, excuse me?
Garbage Man Appreciation Day.
Do we have garbage
It's coming
men
through
anymore?
the landfill.
I thought
as
they were
a
waste haulers.
I'm sorry, that's
Sanitation
just how it
workers?
was put into my notes.
Because we
here,
can't
so
call the landfill a dump anymore, so.
It may be, yeah, so
I'm
we
just
will
kidding.
get the correct terminology for the proclamation. Just know that
Yeah.
that will be coming up, and I've got a note in that we need a future work session on the memorial. That's all I've got.
George's.
Okay, Kelly?
We're only seeing like half of George's head. I can't get his full expression.
I can see he's smiling, his eyes are smiling.
I have a few things. So I do want to acknowledge Nan's request for bringing in the expert to provide us with an economic and work forecast. We don't have a work session on June 30th, and I will be camping in some remote area of Colorado that day, the 30th. So perhaps I would suggest we work with Nan to find a
We
different
can
work
probably
session.
find another day for her to do it for Parks. She lives in Park City.
Hmm.
No, she doesn't live in Park City. She lives in Steamboat Springs. Wrong state.
You know, you can Zoom from anywhere.
I know, I was thinking that. Maybe she'll be in Park City.
I want also to, I want to check in with the board about a discussion related to the state's removal of the homestead tax exemption, which they have decided to do in the next 3 budget years. You know, it's a tough time to ask people on fixed incomes to pay more. And I think we should have a conversation about that if others agree.
Isn't there another one too that they, thought I got another message. From Jenny? Is that, oh, that's repeal property
Okay.
tax assessment rates.
That's a different bill altogether.
That's, would that be part of the discussion too? No?
Maybe, maybe not. George?
Well, yeah, that'd be a different discussion. I think, Patty, you're talking about the Gallagher Amendment. I don't know if that did pass recently, but if so, that's going to have some implications, and what I understand, it may have the ability for counties to decide their own assessment. So, John, you may know more about it, but if that seems to be moving along, then at some point we should be having a discussion in the impacts that we'll have on Pickens County.
CCI opposed it, so whatever if that means. But I just know if we were talking property taxes, homestead thing.
They are separate. One has to do with the budget. So in the budget, the JBC and the governor has removed the
Right. I know
homestead
there's-
tax exemption for the next 3 years.
Right, I know they're exempt, but we're talking property taxes. And
Yeah.
I thought if we're gonna have a discussion, we might wanna broaden it rather than just talk about the homestead, but that's up to you.
And we would know at that point if it passed or failed the
Yeah.
legislature, the
Just-
property tax.
Just for, I'm sorry,
ahead.
I'm interrupting, but just for clarification for the public. So the homestead exemption allows qualified individuals to exempt up to $75,000 of their home or other property value. And there's you can go up to $105,000 if the homeowner or spouse is disabled.
Right,
And
there's
so
a
that
formula,
comes
okay.
off of the property tax. And so that's one piece of legislation that Kelly was referring to, that the state's looking at removing for 3 years, is it? For 3 years. And so that mostly affects older fixed income individuals in the state. Then the Gallagher Amendment sets the ratio between residential properties and commercial properties for property tax purposes. And what's been happening is as residential values have been going up faster than commercial, either because of new construction or such, the residential assessment rate goes down. Statewide, what that means is for districts or jurisdictions that have more residential value than commercial value, their property taxes get impacted more. And so it's
Their income from property taxes.
right, and that's a constitutional amendment, so it'd have to go to a vote. And so there's a referendum that's being proposed for that purpose. So just to make sure we got the two issues.
Does Gallagher
understood.
also bring in agriculture and vacant land property taxes, or just commercial residential? I thought it was all. Well, I could be, I can't remember.
I know vacant is assessed at the 29% that residential is, unless it's contiguous to.
Right,
yeah,
but is it all brought in under Gallagher? I don't know. Can you
I'll
find
have
out?
to check. I'm not
Gallagher,
sure.
Gallagher's just commercial residential with a formula percentage-wise.
Interesting that not all assessment rates are brought in under it. Well, we're not gonna change that, so.
Yeah, so two separate issues,
And
both of them affect property taxes.
That's where I was joining them together, knowing that they're
Well, there
separate.
is a third issue, but
Oh, yeah, what?
there is a bill that is seeking to move the assessment date of when assessors would assess real estate for the next valuation that happens every 2 years. So that is the legislation that CCI, I think they opposed. Anyway, I'm not sure we need to talk about it, but
No. We don't need to talk about that.
well, if, you know.
I have one future agenda item on July 7th. There's an EOT, it's a special meeting emergency resolution for EOTC. John, do you know what that emergency resolution has to do with?
For
It seems
July 7th?
unusual to have an EOTC resolution.
Steve, I'm gonna have to look at that. I don't know. And I talked to David rather recently, so I'll have to ask about that.
Yeah, so if it's a budgetary, we need to have more discussion than just, I don't know.
Kelly?
And then I have one last thing. I don't want to steal George's thunder if he was going to bring this up, but he had forwarded the APSHA work plan, and we will need to ratify the strategic plan. and 5-year work plan at this board. So we have to find time on the agenda to do that.
And not when Kelly is
And
in
I
summer
think
break.
that, I think that Mike and Cindy from ASHA only have time on the agenda for part of that presentation coming up. So it's not this, but I think Charlotte just let me know that they've requested some time.
Oh,
So
yeah,
we could probably roll that in and let them make that presentation.
Okay, any more future agenda items? Patty?
Yeah, I have to have at least a couple more. July 8th, regular meeting. Can we move ski company to the end of the agenda, please? And just for everyone's knowledge, the Board of Health meetings, Greg and I recently discussed at our last one, we were scheduling them every week on Thursdays from 1:30 to 3:30 or whatever time we, was it 1 to 3:30? 1 to 3.
1:30 to
3:30. We've decided we're going to schedule them every other week, and the in-between weeks, Marky and Karen will make a decision as of Monday. I didn't receive anything, though, whether or not we're going to hold the meeting on that off Thursday, just in case there's an emergency or an impending issue that we need to discuss.
I just add, the idea is to alternate the community meetings and Board of Health
Right.
meetings. So
Unless there's something that really is key for Board of Health to discuss,
Right.
then we'll add it back in. So we're reserving that time slot, but the every other week for a regular meeting that's scheduled and for one that's flexible. And that's all I have to add, just so you guys have an update, so you don't try and turn into a meeting day when we're not gonna be there.
Well, one other quick thing for future agendas, John. I don't know if we're able to schedule this, but usually around this time of year, we always have an annual meeting with the Forest Service. And given the COVID situation and campgrounds are opening and some are not opening, and it'd be good to have, if we are able to have an update from the Forest Service at a future agenda that's not too far out, since we're just going into summer season and campgrounds are just starting to open. The Bells opens up on,
today,
it's already open.
yesterday.
Yeah, June 8th. Yeah, so anyway.
Yeah, and George, I think that should be pretty easy. The Forest Service, I want to thank both the BLM and Forest Service who have stayed in close touch over what we're doing with our public health orders and have been trying to coordinate.
And in light of that, George, we did just get an email from Scott Fitzwilliams about this comment period on Forest Service leasing authorities. Do we want to see if Ellen Anderson Ellen has anything that we may want to submit comments for?
I don't know that I got it.
It's about Forest Service Facilities Realignment and Enhancement Act. Under these programs, Forest Service has the authority to enter into long-term lease agreements and qualifying administrative sites in exchange for cash or in-kind considerations. I don't know if there's any of the properties here in Pickens County that may, like the 8th Street building or something else. I don't know. Just don't want to miss an opportunity.
Can you forward that to me? I'm not
Of
sure
course I
was on that
can.
list.
You didn't catch that? I read it so fast. On its way.
Okay, I think we should enter our executive session now. So I will call a special meeting and entertain a motion to go into executive session for the purpose of discussion of airline and FAA negotiations, discounted lease status, public health order enforcement, upper midnight litigation, RES land use application, Rock Creek Road Association litigation, personnel, potential county assistance program, 1041 review of CDOT road signs, all pursuant to CRS 24-6-4024B.
So moved.
Second?
Second.
Okay, it's moved and seconded to go into executive session. All in favor, say aye.
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 Or thumbs up. Okay, we are in executive session. Grassroots, we are done here for the day. We're scheduled for our executive session at 3:45. It'll be on a different link. So we'll all exit here and then go in to executive session on the other one.
Thanks, Grassroots.